left out of the introductions, please do raise your hand if I have. I think I've mostly covered everyone. Thank you all for joining. So generally this is a bit of an informal space and we're here to learn from each other. So I do have a presentation. It's very brief, more to get us thinking about different things around healthy aging, where we are, and some of the topics that we might want to explore a bit. And then at the end, you'll see on the final slide kind of 3 questions just to prompt a start to discussion and sharing of experiences. So as I mentioned, we're looking today at healthy aging and what that means in rural and remote areas. So this was really prompted because recently on the Health Equity Network, one of the people had shared a report from the Resolutions Foundation, which identified that there is a large kind of age gap between regions, and that gap is as large as 25 years between the average age in the oldest and youngest local authorities. And this graph kind of shows how that skews to higher age in more rural and remote kind of towns, villages. So that was kind of a prompt to start this topic today. The next thing I wanted to reflect on was kind of what does aging mean for rural communities, particularly because it is projected that in the next 10, 20 years, there's going to be more and more older people. And in the UK, there'll be a doubling pretty much of the population that's aged over 85. And we need to think about what this could mean for communities, community design, all of these kind of things. There's also, of course, the economic impact, which we need to think about, and the increase in costs of care, what it might mean for an economy if there's lots of pensioners. In some countries, I'm aware that they are trying to look at how to prolong the working lifespan, and there has been some discussion around that in the UK as well recently. So thinking about those kind of topics, as well as the fact that older adults do still contribute quite a lot to the economy through their volunteering activities, caregiving, and their different roles that they take up in their communities. Then I wanted to just reflect a bit more on the health and social care aspect of an aging population. We know that most of the costs of healthcare tend to happen in the last year of life. So that tends to be when people need hospital services the most, which are the most costly for the system. But we also need to think about other topics such as social isolation and loneliness, which can contribute to the health and well-being of older populations. And I've taken out a few of the points that were raised in the Age UK report from 2023. So they reflected on the fact that kind of between 13 and 14,000 patients were in hospital due to kind of lack of social care. 1 in 5 people over 65 are unpaid carers, so it would be interesting to think a little bit about that aspect of things. And the fact that there's a considerable amount of older people who are concerned about their ability to access GP services. And this is important when we think about kind of prevention, maintaining healthy aging, allowing people to stay in the community and stay independent in local communities. So when we think about what we need for healthy aging, there is a concept of kind of age-friendly communities that has been mentioned more often in recent years. And this generally includes thinking about how we involve older people and how we ensure that their voice is being heard, trying to use more of an assets-based approach to rural communities and aging populations, so not just focusing on the negatives and the costs, but thinking about things as an investment and what kind of positive things they can bring to regions and society. I think it's also important to think about not just age-friendly communities, but disability-friendly communities in this regard, because often disability increases with age. And I don't feel this is necessarily mentioned too much in the current discourse. We also know the importance of transport. That's already been mentioned by a few of our participants here. So thinking about community-based transport services and how to enable older adults to maintain their independence, access things like healthcare, and be able to get included in social events and being able to travel to those places. We also need to think about community design, housing adaptations that might be needed for older adults so that they can be safe and comfortable in their local community. And then there's also other aspects like different intergenerational projects, work around digital inclusion, and building community support networks. So this I just took out of that Age UK report, which shows, I guess, the distribution of disability-free life expectancy at 65 in the different regions of England. And we can see that the picture is not the same depending on where you are geographically. And I'm sure there's a lot more kind of granular information missing from this picture as well. I've added a little video here that is from the UK network of age-friendly communities. So I'm just going to play it. It's very short. Again, it just goes over the kind of things we could be thinking about when we want to enable age-friendly places. So hopefully this plays. So I guess with that, I just wanted to highlight that there is some work that's very much being done in this area already that we might want to connect with if different organizations weren't aware of it before. And now I just wanted to move into the discussion really and hand it over to you and get you sharing some of your experiences around, I guess, what challenges you're seeing in regard to aging population in your rural context, and perhaps what is being done or what kind of projects are already happening so that we can hear some of those experiences. So please, whoever feels like they want to share, go ahead.